Hi, I am so elated to meet you in the program of 3 p.m. 3-point medics. We all know that GLP-1 agonist plays a major role in the management of diabetes. What is the rule of 4 for GLP-1 agonist? First, indications for GLP-1 agonist. 1. You should go after or you should search for the existence of atherosclerotic cardiovascular disease when somebody presents with hyperglycemia. Yes, if they present with hyperglycemia or if they come for the management of glycemic control, you should search for any evidence of past history of atherosclerotic cardiovascular disease, including history of CVA and history of MI or past history of unstable angina and peripheral vascular disease. If they have one of these diseases, then please administer GLP-1 agonist to prevent the recurrence of these atherosclerotic cardiovascular event. Number 2, even though there is no evidence of or past history of atherosclerotic cardiovascular disease, or if they have at least the risk factor for developing atherosclerotic cardiovascular disease, yes, please administer GLP-1 agonist. If you find any risk factors for development of atherosclerotic cardiovascular disease, you introduce GLP-1 agonist. What are the high risk factors? Yes, if they have obesity and coexisting hypertension, dyslipidemia and smoking and in fact microalbuminuria, then you administer GLP-1 agonist. And number 3, if there is any evidence of chronic kidney disease. So how will you define chronic kidney disease? If they have eGFR less than 60 ml per minute, or even they have normal GFR but persistent albuminuria more than 3 months after excluding reversible cause of albuminuria, then think of chronic kidney disease. These patients deserve GLP-1 agonist because GLP-1 agonist has been found to reduce the progression of chronic kidney disease. And 4, if patient is obese. So all the 4 causes, definitely you have to think of GLP-1 administration. What are these 4 indications? 1, if there is evidence of past history of atherosclerotic cardiovascular disease. 2, if there is any risk factors for developing atherosclerotic cardiovascular disease. And number 3, and if they have evidence of chronic kidney disease. And 4, if they are obese. Please remember that if they have features of heart failure, it doesn't have much impact on the management of or in the natural history of heart failure, unlike SGLT2 inhibitor. GLP-1 agonists play a major role in the management of diabetes. What are the advantages of GLP-1 agonist? 1, there is no incidence of hypoglycemia when you administer GLP-1 agonist. There is no weight gain. In fact, it makes you lose weight even by 3 to 5 kgs. Even dual GLP-1 agonist definitely will produce weight loss about around 10 kg. So there are so many emerging reports are there. And third one, it protects our beta cells. In fact, it prevents beta cell apoptosis. It helps in proliferation of beta cells and it reduces all kind of cardiovascular event. It reduces the progression of chronic kidney disease and it reduces the adverse events of cardiovascular event. GLP-1 agonists are in the limelight of diabetes management. But when you try to administer GLP-1 agonist, 4 points to be considered. 1, when somebody presents with recurrent vomiting and past history of ileus, be mindful about administration of GLP-1 agonist. And number 2, when they have history of pancreatitis, then you have to reconsider the administration of GLP-1 agonist. And if they have history of gallbladder disease or gallstones, or if they are about to develop gallstones, then you have to withdraw GLP-1 agonist. And there are few reports of thyroid C-cell tumor in the rodents. So be careful about GLP-1 administration if they give history of thyroid cancers in their family or in their individuals. Thank you.